Hi guys, today I'm here with Elizabeth Dalchand. She's an emergency medicine doctor at Stony Brook Medicine, and we really want to sit here and get her insight as to what her day-to-day is looking like right now fighting the pandemic on the front lines. She's going to have some valuable tips for you guys going forward and just give you a lot more information than what's out here at the moment. So Elizabeth, thank you for joining us today, for sitting and talking to us about your experience. We'd love to hear from you telling us how has this pandemic unfolded for you at Stony and what has that experience been like?
Hi, thanks for having me. It's been a whirlwind of changes. I don't think that anybody or any of us could have really predicted how, we were going to handle this. Every single day, we're getting bombarded with emails on new changes. So we actually get a huge influx of patients who came in, and a lot of them are really sick. And usually on a day-to-day basis, we don't generally need to admit a lot of the patients that we're seeing. But because this virus is really affecting a lot of people, a lot of younger people are getting sicker quickly. A lot of people are requiring oxygen, so we do have to admit them. And our hospital is doing a really good job making sure that, we have enough rooms and space for our patients, but that comes at a cost. So in order for us to find these spaces, we had to kind of create new spaces to see patients coming into the ED, and that includes a tent outside of the emergency department where we're seeing patients on a more rapid basis. People are coming in with, things like cough and cold, who may present with very similar coronavirus-like symptoms. And on the inside, so inside the actual hospital and the emergency department themselves, we're seeing the sicker patients, the people who want who need more care.
What would you want people to understand about the virus and how, what are the proper protocols you feel people should be putting into place to really ensure that we flatten this curve and start decreasing our numbers?
So one of the first things that I want to talk about is, coronavirus is a virus that's enveloped by fat. So obviously washing your hands is really important. So, basic hygiene, making sure you're constantly washing your hands, not doing things like I heard yesterday that, some people were drinking Evergreen or something like that. I forgot the name of it, but it's like this really strong alcohol because they're trying to kill the virus. And that's just, it's unnecessary and it's unsafe. So just really washing your hands, making sure that you're, socially distancing yourself from other people, because it is extremely transmissible. And I think that people don't understand, or I'm hoping by now that they do, but it's incredibly transmissible. The second thing is that this notion that it only affects elderly people. I don't know how many patients who I've seen who are, in their, 28 to 52, which is relatively young. They're otherwise healthy. They have no other problems, and they're coming in very sick. Like these patients come in and you're just like, oh, you're so young, and you see their age and you're like, oh, okay, we could probably send them home. You go and see them, you check their vitals, and you're like, wow, you're actually really sick. You're requiring oxygen right now. And these patients tend to, they crash quickly if you don't really, take care of them effectively and immediately. So, I don't want people to think that this is just something that affects the elderly. A lot of people I've been seeing on social media saying like, oh, I think this quarantine is very selfish and ageist. I think that elderly people and baby boomers only want to protect themselves because this virus only affects them. And if they only see, the amount of young people that, we see here who are constantly crashing, it's terrible. The third thing is that, it really is affecting a disproportionate amount of socially disadvantaged, economically disadvantaged, Latinos, the Black community, Caribbean community. It's really disproportionately affecting them. They're really, viruses generally don't discriminate. I think that, there's always a translation barrier and understanding about, how this virus affects other people. And I'm not sure about whether or not these communities were taking this virus as seriously as it is right now. But unfortunately, it is affecting them, at a higher percentage, and they're coming in a lot, very, very, very sick. And a lot of these patients don't see the doctor regularly. So when they come in, they already have some comorbidities that were never diagnosed and they weren't taking medications for before. So, they come in a lot sicker. So that's another thing that, I want to, just put out there, that, these communities should be aware that it is affecting them a little bit more, and they should take, as much precaution as they can.
We're looking for some tips from you as to what people can do at home to tell what their severity of, maybe if they already feel COVID symptoms and they can, if they've been having a fever and any of the other symptoms, what do you think that people can do to tell if their shortness of breath is severe enough to go to the ER, or if they should keep trying to nurse themselves back to health at home?
Yeah, so a lot of the things that we do in the emergency department, you could do at home, right? You could take your temperature, and if it's high, then you could take Tylenol for it, see if it alleviates itself. Because we're really not going to treat fevers other than giving Tylenol anyways.
Mhm.
In terms of the shortness of breath, so there's so many ways that you can monitor whether or not you're short of breath at home. So one of the cutoffs that we use to tell if somebody needs oxygen is the number 92. So we measure this with a pulse oximeter. You can get that at any drugstore, at a CVS or Walmart. It would be nice if communities were able to, have a pulse oximeter available for people to use. But if you put this on your finger and the oximeter shows, and make sure that, on your finger there's no nail polish or anything like that, because if there is, you'll get a false reading and a much lower reading than it should be. But if you put it on, yeah. And so if you put it on your finger and you see that the oxygen is 92, 93, 94, you're feeling uncomfortable, you have some chest pain, that's okay, that's normal. 92 is the cutoff that, there's enough oxygen in your tissues that can perfuse yourself. You are going to feel short of breath, you are going to have chest tightness, and that's normal. If you have asthma, you probably have albuterol inhalers at home. You can take those as needed. If you have a nebulizer machine, you have to be careful about using those, because I know a lot of patients or people have asthma or COPD, they have nebulizer machines. These can aerosolize the particles in the room, so that can spread the virus. You don't want to do that. You could do it in a closed room if you'd like. It just puts, it is a risk of spreading it.
Okay, that's a really good tip to know, and hopefully people are able to use that to monitor things a little bit better so we can keep our numbers down in the ER, and just lower the risk for everyone involved. And going off of this as well, we also discussed the fact that within our Caribbean community itself, there are, what we call WhatsApp doctors. So we have everyone on WhatsApp, obviously other methods of social media as well, spreading a lot of information that may be helpful, but not maybe not set up in the right way. So when we talk about homeopathic remedies like ginger and turmeric, or bush tea, or any of these things that people do believe will cure them, I just wanted you to speak a little bit on how these things are very good remedies for maybe symptom controlling, for example, if respiratory symptoms or things like that, but it's very different from a cure, and why spreading information like that is a little bit dangerous, because other members of the community may believe that maybe this virus isn't as serious as the government is telling us, and may start, going out in public more, or the fact that people may be severely ill and trying to treat it with homeopathic remedies that is not what they need, but they need to be in the ER. So, I just want you to define that line for us.
So I actually took a course on homeopathic medicines too.
Oh, wow. Okay.
Yeah. And a lot of them, none of these homeopathic remedies are FDA approved. Nothing has been really studied. A lot of things are coming from backgrounds, hearsay stories that their family members have been passed down, like from generation to generation, and things that have worked for them anecdotally. So on a medical standpoint, sometimes we can't really comment on that because, we don't have anything to say, no, this doesn't work officially, or yes, this doesn't work officially. What I can say is that, a lot of them have side effects that you don't know. A lot of them can increase your risk of bleeding. It can cause high blood pressure. It can cause a lot of different things that you might not be aware of. And yeah, I understand that, if you're using things like ginger tea and herbal medicines to treat a fever or, muscle aches, sure, that's fine. I can't really recommend it because I don't know exactly what else people are taking and other things like that. But personally, I would rather patients or people like consult with their doctors first. Consult with your primary care physician and tell them, this is what I plan on taking.
When people are taking, like you said, taking these homeopathic remedies, they could maybe help alleviate a fever or body aches, like you touched on. I think that you explaining the science behind there being no cure would also be helpful. A lot of people don't understand what a novel virus is. And so because the symptoms can pass in 2 weeks, they don't, understand what that really means, what that meant that their body did for them in those 2 week span that allowed them to get over coronavirus. So you can talk about a little bit about the science behind it and why the ginger may coincide with the developed immunity and now be sparking rumors of a cure.
So, I mean, the virus itself has like many different strains. I think there's 8, 9, there's several different strains of the virus. And, being a novel virus, it means that, it can kind of transform. It can, there's different strains. So your body attacks it in a different way. And a viral infection is different than a bacterial infection. When you have a bacterial infection, you can probably treat that with antibiotics. With the viral infection, your body develops antibodies that are trying to fight it. You have different cells in your body that are your immune cells that are trying to fight it as well. So, I mean, you're not making any of these cells that are trying to fight this virus by drinking teas and anything like that. Your body is the one that's developing its immunity. It's the one that's fighting the virus. It's not anything that you're going to take or drink or anything like that.
We'll insert a clip where you'll get to see her in full gear and what it looks like to be walking around in the hospital for 12 hours.
So I'm going to take you through what I do to get ready for my shifts. So first thing I do is put on my surgical cap. And then the next thing that I do is usually put on my N95 mask. So the way that you should probably put this on is holding it in the front of your face. The bottom strap going over your head like this. And then the top strap kind of sitting above your head like so. That way you never, you kind of just hang on here, press this up on your nose. And remember, N95s have to be fitted to your face. So going out and buying these masks on your own generally aren't the best idea. And then after that, I put on my surgical mask, which is a paper mask over all of this. And then after all of that is done, I put on my actual face shield, which is really frustrating because it's pretty tight and then you have everything else on you. And then after all of that is done, I would usually wear my plastic gown and then my gloves. Unfortunately, because we have shortages of PPE, I can't just try one on for you guys right now. But all of this we're kind of, going into patients' rooms with. And then when you take it off, obviously donning and doffing is really important. So doffing is what we call taking off our PPE. So you want to make sure that you're grabbing everything by the straps. When you take off your mask, because this is kind of involved with seeing people who might have COVID, you always want to start with the bottom strap. And then you can kind of either let this hang or kind of pull it up. But generally I just do the straps and kind of just take it off like that. And then you can just take this off too.
When, you can hold up the fabric mask that you just showed us, and this is what, if you can make these at home and you can donate them to hospitals nearby, this is helpful for the doctors to place over their reusable N95 and kind of offer them a little level of protection. So we want to thank you for your time, for sitting here and really talking about all these things with us today. Pray that you guys stay safe and healthy and come out on the other side of this. And we thank you for your service and everything that you're doing day to day.
No problem. Stay safe.
Thank you. You too.